Jennifer Wells. I am one of the SLPs in the clinic. I'm also one of the clinical supervisors. I've been a clinical supervisor here for about 1.5 years, but I also did my grad program here. So obviously I liked it enough to come back and work for the university. So I'm going to talk to you about a few things today, but the first one being this room. So like Brenna said, we call it the preschool room, mostly because it has a lot of materials and activities and things that are best used for that preschool age. We have some over here, we have some gross motor materials for movement activities. We have different kind of alternative seating options, a yoga ball, some smaller chairs for those littler kids, and all the students also, no matter what treatment room they're doing their sessions in, they can come in here and grab materials for those sessions. So if they're seeing a younger kid but in a different room, they can still utilize these resources. Some of the bigger play options, there's a play kitchen over there, the Lego table, things like that, this big dollhouse. They just live in here as there's more space, but of course they're used for all sorts of sessions too. One of the things that happen in this room is one of our summer camps. So we do a variety of different summer camps for different ages. It provides unique experiences for the students in their summer semester. So one of the ones that happens in here is for that kind of preschool, school age kiddos, we do a language support summer camp, but that also involves literacy and gross motor and social skills and some art projects and science experiments. So it's kind of a STEAM-based summer camp. And sometimes we use the board behind you. It's an interactive smart board. So that's one of the summer camps, but then we have some other offerings. We do an articulation camp, a camp for AAC users, a stuttering fluency camp. We do a social skills camp for school age and middle school kids. We do a reading camp for it's kind of that grades 2 to 5 area. And what else? We do a college readiness summer camp for high school juniors and seniors. And then this year we're offering a adult brain health camp for adults 40 and up. So those are just some unique special opportunities for the students and for just kind of, we can offer more to the community. So in this room also, we use a lot of these materials for early language therapy. So we do a lot of play-based and child-led therapy approaches for kids as young as 6 months to 2, 3, 4 years old, where we want to provide language support in their most natural environment, which is always usually play or with their parents. So we do some parent coaching model also. So sometimes that's in here, sometimes it's in the other rooms, but I thought this was a good opportunity to tell you about it. The other thing that we do in here, because there's a sink, is some feeding therapy. So we do sometimes, mostly with pediatrics, sometimes it's oral motor therapy, so working on chewing and swallowing, and sometimes it's more sensory feeding therapy, so kids who may be labeled as picky eaters or have sensory aversions to specific textures or tastes or things like that. So we do a lot of food play in here, things like that, to support those families. So those are kind of my main topics. Do you guys have any questions at all?